So we have a C7 supine.
Anna's talking.
So we have a C7. So our patient got elbow extension, elbow flexion, forearm pronation, forearm supination, wrist flexion, and extension. So we need to teach our patient how to, before supine, to sit first.
First she's going to go supine to sideline and then sideline to sit. So what we're going to instruct her to do is so you're going to go ahead and you're going to move your lower extremity over, cross it over with your hands, which she has. So she can either hook it or grab it. So she got it over there. And then the next, what she's going to do is you can go ahead and bring this out. So we're going to go work on some momentum, but she's going to get into the sideline position. So count to 3 and then swing yourself over. Good job. All right, now the next thing she's going to do is she's going to bring her lower extremities off the table. So she can either grab it or hook. She can hook it behind. Just slide.
What would be one other thing that she could use, like a device of some sort?
She can use a towel or to swing.
Right? Or one of those like strapping devices.
Like lifters.
Or like lift dog walker. Huh?
Dog walker.
Oh, well,
some kind of strap.
Which is the leg lifter, yeah.
Okay, and then so she has a full shoulder movement. So she's going to go shoulder AB abduction, push herself up, get up onto her forearm, and then to eventually push yourself up here.
All right. Very good. Questions on that? No? Okay, and the next thing you have?
The next, no, we have 3 wheel, clear the wheel.
Oh, yeah. So they're going to demonstrate 3 different ways to clear the wheel.
So we're doing 3 different ways to clear the wheel, and one of them is hooking your arm behind the back of the chair and using momentum of the other arm to be able to slide the pelvis forward. So we're just sliding one part of the pelvis forward to prepare for transfer. No.
That's why we teach appreciation.
So then we're just going to swing with momentum, and then as you come through, then her pelvis starts to slide forward. And then if she needs to go further, then she can just do it a little harder again, if she had to.
So show the other side. Show her actually getting towards the end.
The end. Oh, with the other arm?
Yeah.
Okay, so then pull this arm out. Put this arm up. Look up. Look up. Let do this arm and hook this arm around. No.
The other one, no.
Stay forward. No. Just
The real spinal cord injury patient couldn't have done what Anna just did.
Just rest your arm back behind, and then swing this arm through your other pelvis, so your pelvis comes back forward. So we're just scooting one side of the pelvis.
Oh.
Right. And then release that arm.
And you can see where the momentum really
And then don't move. And then reach that one back.
is needed in order to get them, over. You might even couple it with, if you can cross their legs, you might do that as well to help.
In the direction they're going.
Right, in the direction they're going. Certainly maybe even, especially when they're learning some of the active assist, us helping, maybe being a little bit more hands-on as a therapist until they kind of get it a little bit better. Now, this particular patient who uses this technique, she's hooking on and going like this, right? Is this person the C7 patient?
No.
Why not?
They wouldn't have that much activity.
Because the C7 patient had a lot more stuff going on. The C7 patient isn't going to have to do that.
You mean C7?
No, the C7 patient is not going to have to do that.
Oh.
I asked you to
so
demonstrate. Right, but I'm just saying a C7 patient, that's a lot of work.
They can pull them close.
Yeah, they have elbow extension.
Right.
Yeah, they can do other things. They don't have to do that. But for the person who has that elbow flexion, that's where that can be really useful in hooking themselves around like that. Okay. That was one of the techniques. There's 2 more.
Do you want to do you want me to do?
Here, I'll sit in the wheel.
So we're gonna teach the patient how to do the bridging. So forward, okay, and just scoot forward a little bit more, and scoot forward a little bit more, okay. And then the other technique that we have.
Okay, now that particular patient, what would be the minimal they'd have to be in order to do that technique?
Elbow flexion.
No, that's
C7 elbow extension. they don't have elbow extension, they're not going to be able to extend their elbows. Okay.
Okay, and the other technique, we have to teach patient how to, go on the edge of the wheelchair. So lean forward as you can, and try to rotate your buttocks, one right one and left one, and move to the edge of the wheelchair.
This might also be one that could be more for the person or the patient that needs more assistance, that's lower level. Because if they can have that extreme trunk flexion forward, then you might be teaching them to teach the caregiver, or teaching the caregiver who might be there in the training that this is how we're doing it. So, Tom is leaning all the way forward, try to get some weight off of his buttocks. That's how we get his buttocks forward. And then you might need to put your hand underneath his, go underneath his right side, his left side, and scoot him forward. Then go underneath his right side and scoot him forward. So again, because if he could do what he just did, he probably wouldn't pick that technique, because who wants to be uncomfortable leaning forward like that and scooting forward. So just keep that in mind. These are 3 different techniques, but if you need to know, if I tell you your patient is a C5, what's going to be the best one to use? C6, C7, T1, so on and so forth, okay? Knowing what they need to, I'm sorry, that's funny, but what they need to be in order to, yeah, we'll just move on.
And just to clarify with that, like Jill said, you might need to put some who are under, like, ischial tuberosity, under their butt cheek. You're not just, giving them a little nudge forward on their lower back.
Exactly. This was actually a technique I used a lot with a girl that I worked with years ago, and I say girl, loosely, she was in her 20s, but she had suffered from this very rare genetic disease. So every time she was trying to sit upright, all she did was go into extension. The only way to get rid of that was to have her into this extreme forward flexion, and that's how I was able to get then her bottom forward, but she couldn't do it on her own. And it wasn't spinal cord injury either. So that's actually a good point too, that these are not techniques that are just for spinal cord injury either.